Good evening and welcome to the COVID-19 update on Channels Television. I am Kayode Okikiolu. Here are some of the highlights. More worries as confirmed COVID-19 cases remain on the rise. And you wonder what will be the implication of the reopening of schools and worship centers and the battle against COVID-19. School leadership in Niger State threatened to turn back students without face masks beginning from tomorrow. And as global COVID-19 cases surpass the 20 million mark, World Health Organization advises governments that the only way to safely have schools reopen is to suppress the virus. We begin with a daily briefing of the Presidential Task Force in the nation's capital, Abuja. Well, today the committee said it is monitoring the progress of the war against COVID-19 with a view to strengthening the campaign against the deadly virus. The chairman of the committee, Mr. Boss Mustafa, informed the nation that global cases have surpassed 20 million and there is need to raise the quantum of tests by 1 million in Nigeria. According to him, although schools have reopened, there will be need to monitor the schools and the transport sector. The committee says 5 states are responsible for 50% of COVID-19 cases in Nigeria, and 549 local government areas of the 774 local government areas have recorded cases. And there you see live pictures from the briefing. We'll bring you the report or the track much later. Well, 437 new confirmed cases, 142 patients discharged, and 3 fatalities. Well, those are the latest COVID-19 figures from the Nigeria Center for Disease Control, the NCDC. The nation's lead public health institute puts the total confirmed cases at 46,577, total discharges at 33,186, and 945 deaths, with 12,446 patients still receiving care across various COVID-19 isolation centers in the country. The latest cases are in 16 states and the FCT. Lagos leads with 107, FCT 91, Plateau 81, Kaduna 32, Ogun 30, Kwara 24, Ebonyi 19, Ekiti 17, Oyo 8, Borno and Edo 6 each, Kano with 4, Nasarawa, Osun and Taraba with 3 each, Gombe 2, and Bauchi with 1 case. Well, schools in Niger State have reopened for graduating classes, and even though most of the schools visited provided wash facilities for students and teachers, the use of face masks among the students remains a major challenge. Our correspondent, Ebro Simon, gives us an update.
For about 5 months, schools in Niger State were under lock and key due to the outbreak of COVID-19. Now they have resumed for exit classes. We went around the schools to monitor the situation. In some of the schools we have visited, we noticed that many of the students do not have their face masks on. We chatted with the school management at the Government Girls' Day Secondary School, Mina, on why some of the students are not wearing face masks.
I've just given them the benefit of that today. By tomorrow, any of them that didn't come with a face mask, as you can hear me speak to them, correcting them not to hug, not to shake, not. If they didn't come with face mask today, either the government give us or the parents provide just 100 naira face mask, we may ask some of them to stay behind for the revision. But I know they've already collected the number of the students that are writing exams, and the total of those number will be given face masks. Government have given to other schools, some few schools already.
For some of the students, returning to school to meet certain protocol in place is really strange.
I feel strange because it has not happened before. This is the first time I'm experiencing such thing. You know, coming to school without shaking your friend, without having this long conversation. Well, but I'm happy it has to do with the safety of the state and of our own self personally.
I've prepared, but not as when we are in school before. But now, actually, I'm a little bit scared about the exam. But thank God we are still trying our best.
I'm not happy because all what we are doing in the school, all I have forgot many things about. Because now even I brought my book to read. Something small, I will forgot it because we stay at home long time.
Over 52,000 students across the 25 local government areas of Niger State are expected to resume for WAEC and NECO examination. Niger State currently has a total of 226 confirmed positive cases of COVID-19. Although the state government says it is optimistic that the measures it has put in place in schools to ensure safety of students and teachers will yield result. From Mina, the Niger State capital, Emperor Simon for COVID-19 update.
Let's now head over to Bauchi State, where students in exit classes have also resumed, but most of the schools visited have converted classes that were previously meant for the lower classes to be used by the SSS3 students. Our correspondent in Bauchi State, who monitored the resumption, also reports that some of the schools now have clinics for emergency purposes.
This is one of the public schools in Bauchi State's Government Day Secondary School, Bakari Duku. For now, only SS3 students have resumed. That's about 400 to 500 students. Previously, there was 80 to 100 students in a classroom. And this is replicated across most public schools in Bauchi State. But right now, the arrangement is entirely different. 20 pupils now accommodate a class, and only one pupil is allowed to sit on a desk.
The students are not allowed to come into the school without washing their hands and without the using of face masks. The Ministry of Education supply enough face masks for the students. Each student receives his own by the gate before entering into the school. And the seating arrangement in our classes, we want to ensure social and physical distances in the classes. The twin desks provided by the government are now converted to a single student per seat. We don't allow two students to sit down on a seat.
The school now has the capacity to create more classrooms for the SS3 pupils because other classes are yet to resume. 9 more classes have been created, making it 15 for SS3 students alone. There was SS3 A to F, but right now there are more classes for them in addition to the examination hall that has also been converted into a classroom.
Before we have about 6 streams, JS1, JS2, JS3, SS1, 2, 3. Now it is only a single set that are resuming. So the remaining teachers are invited. We call the remaining teachers to come. So the problem of manpower, we didn't have it.
One of the criteria set by the Ministry of Education is that every school must have a functional clinic and a holding room. And in case there is none, the school is expected to convert one of its classrooms into a functional clinic. From Bauchi, Hajara Aliyu for COVID-19 updates.
Let's head back to the Presidential Task Force on COVID-19 briefing, which is holding in the nation's capital, Abuja, where the chairman of the committee, Mr. Boss Mustafa, informed the nation that global cases have surpassed 20 million and there is need to raise the quantum of tests by 1 million in Nigeria.
Today, the global numbers of confirmed cases surpass 20 million. And there's a record of over 750,000 deaths. These statistics remain serious warning signals, accompanied with pains and anguish to families and friends that have lost loved ones. Africa's confirmed cases have surpassed the 1 million mark, which is a landmark. The challenge, however, is that the true numbers could be higher because we suspect strongly that for every reported case, up to 7 might have been missed. Ladies and gentlemen, the numbers are surging. Community spread has taken root and expanded beyond the urban areas. Now we have infections right into the rural communities and localized areas. The watchword is vigilance and taking extra care.
And with that revelation from the chairman of the PTF on COVID-19, let's join Dr. Jago Akolo, who's Registrar, Public Health Department, University of Abuja Teaching Hospital. He joins us live from our Abuja studio this evening. Thank you for joining us on the program. Now, I'd like to begin with those revelations from the chairman of the Presidential Task Force on COVID-19, saying that, this community spread is even beyond urban areas. We've moved into rural areas. And he said that, we need to be vigilant and take proper precautions. Now, hearing that, how does it hit you?
Well, that is the true state of the current situation as it relates to COVID-19. That is just the truth about it. A lot of communities now are involved. There is community transmission currently ongoing in the rural communities. And the funny thing is that this virus will continue to spread unabated if we do not adhere strictly to the public health measures that is expected. The wearing of face masks cannot be overemphasized. The frequent and regular hand washing and use of hand sanitizers cannot be overemphasized. These are public health measures that we need to do now and then to cope or to reduce the spread of this disease in our community.
Okay,
and everybody needs to be part of this fight.
Yeah, let's talk about schools reopening. I mean, you've talked about this public health measures, but regarding schools reopening across the country, apparently some parents did not allow their children to resume in Kaduna State, for example, and these measures are there. One wonders really what can be done there.
Yeah, it's actually a dicey one because the parents also care for their wards. They want the safety of their children as well. And the most important thing now that the federal government has reopened the school, adherence is key. And even when you talk about the use of face mask, we must use the face mask appropriately and properly. So we need to know how to put on the face masks right. We need to know how to remove and discard it appropriately. Otherwise, we may actually use the face mask, and if we don't use it properly, it will even enhance even further the spread of the disease. And another thing is most of these rural communities, most especially the schools in the rural communities, you discover that most of them hardly even have potable drinking water. And with the supplier of these public health face masks and sanitizers, will it be regular? So that is the question. Today they may have a face mask. Are they going to use the same face mask the next day? Or the next day they will be provided with a new one? So compliance is very, very key to ensure that this virus is coped, even from the grassroots. And grassroots mobilization and grassroots adherence to these public health measures is key in containing this COVID-19. We must fight it all together. All stakeholders must bring all hands on deck to ensure that we fight to finish and to bring COVID-19 or coronavirus to an end.
Well, I mean, those suggestions are vital, especially as we don't look forward to a second wave. But I would like to thank you so much, Dr. Jago Akolo, a Registrar of Public Health Department, University of Abuja Teaching Hospital. Thank you for your thoughts this evening.
Thank you very much for having me.
And so we take a break now on the program, and when we return, the WHO has a strong message for governments as global infection figures hit 20 million. Join us again. You're welcome back. Now, as graduates and students prepare ahead of August the 17th examination date, well, those seeking admission into tertiary institutions now have a definite date for their post-UTME screening. The Joint Admissions and Matriculation Board, JAMB, has fixed September the 7th to November the 18th for the commencement of screening across the nation's tertiary institutions. And some students registered for the West African Examination Council's senior school examination have resumed in Benin City, the Edo State capital, after about a 4-month break, which was meant to protect them from contracting the virus. The students, their teachers and other school officials were made to comply with the safety measures before entering into and while within the school premises.
Scrutiny begins right at the gate at Idia College in Benin City, the Edo State capital, where the government's guidelines for COVID-19 prevention apply not only to the students. Hand hygiene is also ensured. One of the students believes she and her colleagues would be safe as they follow the NCDC protocol.
With the way things are going on, with the way the school have been cleared, I feel that during this period, everything will be okay. At least with the 1 meter social distance during the examination, there is less concern that we students will contract this coronavirus.
The Edo State government has made arrangements for compliance to be monitored. The reason the permanent secretary of the Ministry of Education is here.
I can see every one of you wearing your face mask. This is quite commendable. There were so many meetings we had with proprietors of private schools and principals of secondary schools to intimate them with the guideline on safe reopening of schools as directed by the Federal Ministry of Education. And in one of the meetings, the officials of the Ministry of Health were present to sensitize these heads on how to manage the students safely when they resume school.
At Edopolo Grammar School, the principal lists the safety measures already in place while the students are being awaited.
The face mask has also been provided by the government with this infrared thermometer, which we use. You can see the Veronica bucket.
Ehosa Anglican Grammar School is a private school. The government's directives are followed here as well.
Any person that will enter must put on their face masks because we want to keep our students safe. And right there in this hall, before students will enter, they must also put on their face mask. And any teacher that will enter to go and teach them must also be on their face masks.
The authorities are confident that the guidelines would help ensure the safety of their students and schools officials, and are determined to see that there is no breach on their watch. Jessica Olubuse, Channels Television News.
Sophia Osawe is a medical laboratory scientist who joins us from Jos, the Plateau State capital. She joins us via Skype this evening. Thank you for staying with us on the program. Well, let me begin with the statement which the SGF made moments ago at the briefing, when he says that we need to increase our tests by a quantum of 1 million. Now, when you look at our performance regarding tests so far over this past 5 months, you see we've just done over 319,000 tests. And the big question is, how can we achieve that?
Hello, good evening. Let me begin by saying thank you for having me on your show. It's really an honor. You are right. So many countries have tested in the millions. If we see US and other developing countries in Europe, we haven't done much, and this is 5 months and counting. I know the government and NCDC have done a lot to make sure that we have a lot of labs. Currently, we have about 62 labs in the country. And testing is ongoing. However, there are challenges with that. We definitely need to test more. It's when we test that we'll know the actual numbers, so we know how to curtail this virus. We have a lot of asymptomatic cases, and that's one of the issues. Asymptomatic means when you don't show symptoms, and then you still are able to transmit the virus. So testing is crucial, and now it has to be community-level testing.
You know, I'm just wondering, how hard is it to, bring testing closer to the people? Because, we've heard that logistics is a major issue to achieving our daily target for tests in the country. But how hard is it? And what kind of challenges do you face? Because we need to fix these challenges if we'll hit that 1 million target.
Yeah, you're absolutely right. There are many challenges, and we're in a developing country. One of the things is that right now, it's a pandemic, so everybody wants to do testing. So we're fighting for the same kits and reagents. So we all know, a lot of us know that it's the testing that we use to confirm COVID disease is PCR. Now, this is a high-tech. We have the capacity in the country. We have equipment and platforms that can test so many at a time, but we need that support for reagents. We need a better sample collection procedure. We need people to be reached out. So there are many challenges, but the key challenge is the capacity to actually test by getting the reagents
Right.
for this through equipment.
Okay, just let's see if we can signpost this as our parting shots. Now, we've seen that this has exposed our flaws, our healthcare system flaws in the country, and we've said that we need to focus on it. Have you seen any change so far?
I have seen some changes, some positive changes in the country. I know we had a kind of dilapidated system, but we have tried to improve. Although one part that I'm not very happy with is the community response. I can give you an example that some people will say they don't believe COVID exists. Some people don't adhere to the rules. I mean, I traveled recently to Abuja, and on the way, I could hardly see anyone wearing a mask, and they were inside markets, and it was crowded. So that's one of the challenges we're having. The community actually trusting science and trusting what we're saying about COVID. That's one. So we need to gain the confidence of the community to make sure that they themselves make the first step of protecting themselves.
Okay,
And then
I think
the
that's a great
government
place to anchor. I apologize, but we'll definitely have this conversation subsequently. But I'd like to thank you so much, Sophia Osawe, a medical laboratory scientist, joining us live from Jos, the Plateau State capital. Well, as global COVID-19 figures across the world cross the 20 million mark, the World Health Organization is asking governments to take action to suppress community transmission of the coronavirus. The head of the WHO, Dr. Tedros Ghebreyesus, says he expects worldwide cases of COVID-19 to pass the 20 million mark, which it has, and governments must ensure there is adequate control of transmission within communities for schools to reopen safely.
As COVID-19 infections in Latin America top 5.5 million, Brazil has recorded more than 100,000 deaths linked to COVID-19, the world's second highest figure, as the outbreak in the country shows no sign of easing. Meanwhile, the number of infections and deaths in the United States has also reached new heights. America and Brazil are two countries that have struggled to bring their outbreaks under control. The US has seen more than 5 million infections and 162,000 deaths to date. Parisians and holidaymakers strolling along the banks of the river or browsing open-air markets in Paris must now wear a face mask from Monday after authorities imposed new measures to curb a rise in coronavirus infections.
We'll take a look at our website, channelstv.com, which has the latest updates on the pandemic. All you need to do is log on and access the news in health, politics, business, sports, Africa, and around the world, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikelu. Do stay healthy and stay safe.